Next, we do have Tom Magner from Carers World Radio.
Good afternoon. Thank you, Cabinet Secretary. Regarding opening up lockdown, my question is specifically about carers in the family home who have a job. If your boss is bullying you back to an unsafe workplace, but you can't get home care support that's safe against coronavirus, and you're forced to make a stark choice, I know it shouldn't happen, but it does. Which do you say is more important and why? Going back to work to earn money and risk care standards in your home, or rely on state benefits to stay at home and care for the person you love?
So thanks very much, Thomas. It is an important question. I would say one thing before I ask both Jason and Fiona to give us some advice on that. And the thing I would say about that is if in Scotland we have anyone in that position where they feel that they are being pressurised by their employer to return to work, notwithstanding the difficult circumstances that, Tom, you've outlined, then we want to know about that. Because my colleague, Ms Hislop, who's our Economy Secretary, is regularly in touch with employers, is working with employers to help them understand what they need to do to help us, as we hear from them what we need to do to help them, and can work through some of those particular difficult issues as best we can. So we do want to know about that, because that is a very unfair place for someone to feel that they have been put into the position of trying to make that very, very difficult choice. But let me go first to Jason, and then I'll pick up with Fiona to see if there's more that they want to add at this point.
Well, only very briefly. I've spent longer with the unions during this pandemic than I ever have in my previous career. I've made it very clear to them and employers that none of the clinical advice is financial advice. Anybody who finds it they're unable to follow the clinical advice for financial reasons, I think is wrong. And they should, if they can't get that sorted at employer level, they should raise it with their union, if they have one, and raise it with the government or the local authority. And we should be able to fix it.
And I think, building on what Jason said about the employer, what employers have to remember, now that we have our test and protect system in place, good employment practices will mean that their members of staff will not have to self-isolate for 14 days. So it's going to be important that employers honour and respect and embrace the advice that we're giving to keep the population safe. If somebody is a carer for somebody, then pre-COVID, the arrangements then should stand. So if somebody had care at home or self-directed supports, then that should continue. And again, that's something that the Cabinet Secretary has intervened on in terms of making sure that there is sufficient care at home for people who need that support, that would then enable their carer to go back to work, but only to go back to work safely, because clearly it's important that the carer feels that they'll have the right protective equipment when they're at work. They can travel to work safely if that's by public transport, so that they are not bringing the virus home to their loved one who perhaps is vulnerable if they're requiring to be cared for at home.